Hello, fellow type 1s. My question for you today is, what number do you feel low at? Well, I'm actually going to tell you why you can't really answer that question. I get that question all the time. If you're just finding my videos, my name is Dr. Jody Stanislaw. I've had type 1 diabetes for 40 years now. Let's see, how's Dex doing today? What's my number today? Not bad. I'm going a little low. I just had a little snack. But that's my last few hours here. Pretty flat line. This is what's possible for you when patients work with me or you follow my online course. But I want to answer this question. What number do you feel low at? Well, you can't answer that. And this is why. It all depends on your momentum, okay? You can feel low at 100 because the momentum of your blood sugar level is like this. Or you cannot feel low at 70 because the momentum of your blood sugar level is like this, right? So this concept of momentum of blood sugar level is so important. And now that luckily we have most people, well, I won't say most people because that's not true, that many people have CGMs and that we just simply have the technology of a CGM, continuous glucose monitor, we can really understand how important momentum is, right? A flat 70 with no insulin on board, or even, a flat 80 is actually a low normal. And if it's not headed low, you don't even have to, treat that. Now, this is assuming you understand where the momentum of your blood sugar level is going. But of course, if you have a lot of insulin on board, you've recently bolused in the past hour or two, or even 3 hours, and you're headed down, then yeah, you could absolutely feel low at even 100, right? So we've got to get really smart about thinking beyond these just concrete in stone, rules that we've been given, like treat a 65 with 4 glucose tabs, or 120 is not low, or my insulin to carb ratio is 1:15, right? There's none of these work 100% of the time, right? Like I said, at 120, you can really feel low. If you're going double down arrow, you can already feel low at 120. Insulin carb ratios, they change all the time depending on what time of day, what you're eating. And insulin to carb ratio isn't even enough of what you need to know how to properly dose a meal, because it's only assuming that carbohydrates affect our blood sugar level when that is not true. Different kinds of carbohydrates affect our blood sugar differently, as well as protein, fat, what time of day. So when patients work with me, because I get to work virtually with patients all over the world, these are the things that I can help you understand, is how to become a better mealtime doser so that you stay in range before your meal, during your meal, after your meal. I'm not perfect. I don't stay in range all the time at all. But my goal range is 80 to 120, to be honest. My high alarm on my CGM is 120. And this is what I teach patients when I work with you privately, is how to get tighter control without going crazy, and with being smart and with being empowered. There's so many type 1s out there that I feel like we're just not educated enough to feel empowered. We kind of feel like diabetes is this thing that's out of our control. And, it does feel out of control if we're not properly educated. So that is why I've been coming to you guys live Monday through Friday, right around 3 p.m. Pacific, 6 p.m. Eastern, to give you some tips to how to better manage your type 1. I decided to start coming on end of March just to kind of give you some extra inspiration due to COVID. And now it's just become this fun thing that I do Monday through Friday. I don't know if I'll keep up forever Monday through Friday. But I've got some great videos that can really help you master your blood sugar level. And let me tell you, below 7% A1C, or even below 6.5, is the goal for most people. Association of Clinical Endocrinologists recommend below 6.5. And mine's been around 5.9, 5.5, 6.1. Those were my range for the past about 10 years. But I've had type 1 for 40 years. So I can relate if you're feeling overwhelmed or frustrated, or your A1C is 7.5 or higher, and maybe you're not feeling supported. I get it. I've been in those shoes a lot. So, but I want you to be empowered to take better care of yourself, and that is what I'm here for. So you can go to my Facebook page and check out the videos. But today's point that I want you to get is that all lows are not created equal, right? Some lows need 5 glucose tabs. Some lows need 1 glucose tab. Some lows you don't feel until you're 70. Other lows you can feel when you're 90. It all depends on momentum. We got to be smarter and really think about what's going on with our insulin, our food digesting, all of that stuff. Okay. So if you want to learn more, take a look at my courses on my website, drjodynd.com, and then click on T1D classes. I have a great course on how to get off the blood sugar roller coaster, nutrition and how to dose properly, since carb counting alone is not enough. And then how to master your blood sugar with exercise, which is awesome, right? It's how to exercise without going low and not having to eat a whole bunch. I mean, I spent years eating a whole bunch. We don't have to do that anymore. So these are really important tips. But go ahead and scroll down my Facebook page. You'll learn more tips. Today's tip is all about how all lows are not created equal. So have a great day, and I'll see you tomorrow. Bye for now.